I welcome you, my dad, in the next panel of Health World. And because we have a 30-minute delay, I proceed introducing right away the speakers, Mr. Vassilis Kontozamanis, who is the former alternate Minister of Health, Mr. Andreas Xanthos, who is also the former Minister of Health and member of the Hellenic Parliament for SYRIZA, in charge for this political party for the issues of health, Mr. Konstantinos Bargiotas from Larissa. So we've got three politicians, three of which are physicians, and a more independent look. I welcome the Professor Emeritus of Social and Preventive Medicine in the Medical School of University of Athens, Mr. Yannis Tountas. Good evening to all, and give the floor right away to Mr. Vassilis Kontozamanis. Please observe the time. We've already exceeded the time till now. We must observe it.
Thank you very much, Mr. Telloglou. I'd like to thank the AmCham for the invitation. This is an opportunity to see what we have in the pipeline in the day after the pandemic for the national healthcare system. We have to agree, all of us, that the pandemic left a legacy for the national healthcare system with respect to its DMO. We normally discuss about the weaknesses of the healthcare system. I think the pandemic highlighted its strengths as well, and it allowed us to proceed with planning the next steps with respect to the improvements in the healthcare system. The pandemic allowed us to expedite changes in the healthcare system and turn these reforms into a one-way street against anachronistic and quite reactionary fixations, like the collaboration with the public, the private sector. Even before the electoral let's say, agenda of Demokratia, the issue was here, but changes as a result were delayed, necessarily so, because of the pandemic. However, we did things during the pandemic, and I think it's high time that we moved forward with the things we have already planned. I think everybody will agree, like Mr. Xanthos, Mr. Bargiotas will also agree on the fact that it's high time that we proceeded with changes in the healthcare system. I think that the national healthcare system is about to retire, and it's time to have a brand new beginning. Of course, each and everyone has a different perception of the kind of changes that have to take place. Characteristically enough, we believe that PPPs represent a very useful tool to finance new infrastructures and services for the healthcare system without additional burden to the taxpayer. The opposition, on the other hand, believes that this is a tool to promote privatization of the healthcare system. It goes without saying that disagreements, criticism are most welcome, and it's quite reasonable to have. But I truly believe that if we are able to rely on the facts, on the documentation, let's say, we may find some common ground and move forward with the changes needed. I truly believe that these changes have to take place. We're talking about three pillars of change. And of course, we have discussed about the changes according to this pillar: HR, the healthcare system, and the healthcare services. Allow me to say that while drafting these changes, while planning these changes, for the first time, we analyzed the requirements of the population and we mapped demand, not supply of healthcare services. That's of major importance because in the past we used to take care only of the supply. We know very well that the personnel, the medical personnel ages as well. We need some newcomers, and that's why we have to make plans. We have to make plans for that. That's why we're discussing with peers abroad in order to have a preventive model implemented for the needs in terms of our workforce, using more than population-based indicators. For instance, how many doctors should we have in a hospital or per bed, etc. Certain steps were taken during the pandemic. The healthcare system was strengthened by means of additional recruitment, additional staffing, but we need strategic planning, and this is underway so that in the coming years we will be able to move forward and be able to meet the challenges ahead. We have brand new specializations. The specializations of physicians change, and we have to adapt. I already discussed about PPPs. I believe it's a very useful tool in order to provide new healthcare services and improve the existing ones. As I said before, it is a financing tool. It adds no additional cost to the taxpayer, and we have to fully use it. We're not here to reinvent the wheel. These models have been implemented abroad successfully already. Everybody talks, and I think we agree on that, everybody talks about the need for a change in the healthcare system. And I think Professor Tountas will talk about that because he has also been member of the committee of wise men, as we call it, a committee of experts in the context of the Healthcare Services Quality Assurance Committee. We had 13 members of the academia, if I'm not mistaken, yes, 13, and they agreed on certain principles that have to characterize the hospital reforms, because in the past we got accustomed to healthcare services being provided from the moment we step foot in the hospital until the moment we step out. There has to be interoperability, an ongoing character of these services, and collaboration between all stakeholders across the spectrum of healthcare services, starting from the primary sector, the primary healthcare services, second level, third level, etc., down to the palliative care, recovery, etc. And that's very important because having such a map available doesn't mean that we have to close down hospitals or that we will have to change the use of certain premises. No, there will be synergies, complementarity, and in this map, in the context of this map, we will have to review the kind of relations between the private and public sector. I think that was made quite evident during the pandemic, that because there was such collaboration. And of course, we have to review the interoperability with military hospital facilities. Having said that, I believe that with respect to infrastructures, we have a huge instrument available, the RRF. It enables us to modernize infrastructures and move forward with building iconic projects such as the Center for Cellular and Genome Research in Thessaloniki. It's one of our proposals already tabled before to the RRF, amongst other things. We also have a center for radiotherapies, etc. We have some other issues. ODP, which was established during the pandemic, is an organization that has already delivered results. It is a tool that we lacked in the context of the healthcare system. We're talking about the assessment of health services and the upgrade of the quality of services we provide. In our country, most of you don't know that, was unable to provide data or figures about the quality of the healthcare services provided, and this is about to change. We have planned the package of indicators in terms of responsiveness, adequacy, and efficiency of the system. And of course, we have already planned the way the system will be fed with data and details. So the quality control organization worked during the pandemics. We made more than 16 missions to hospitals across the country. And we have been able to identify at the clinical level certain bottlenecks, weaknesses. We provided guidelines, and room was found to improve the service provided. This is also linked to our strategy for the workforce. Now it's time to provide the workforce with incentives. I'm not talking just about the physicians, I'm talking about all personnel. We already have a bill about potential incentives for physicians. We all know that. Mr. Xanthos has dealt with that issue during his spell at the ministry. I don't think that there is anyone to disagree with that. We need to give incentives in order to cover special health-related needs in remote, mainly areas, so that we enable qualified doctors to come back from abroad. And they will come back once we give them the opportunity once we establish a regime of meritocracy so that the best will be the head of a clinic. The best will be able to have a career in the national healthcare system. Given that I'm running out of time, let me be brief. Some other useful tools that we have considered have to do with participation of our country at the Paris project. We're talking about a project on evaluating healthcare services provided by the citizens themselves, the so-called PREMS and PROMs. We were given the opportunity during the pandemic to build a manual on how a hospital should be run during a crisis, how a crisis should be dealt with. And this is extremely important because one day or another the pandemic will be over. We will need something like that in the future, plus other tools useful in the future. And these tools will allow us to overhaul the healthcare system. One last thing. The pandemic highlighted the need to become self-sufficient and autonomous, if you like. I'm not talking just about Greece, I'm talking about all countries when it comes to the supply of main, the procurement of specific certain supplies, drugs, medicines, medicinal products, equipment, etc. Greece played a starring role. We saw that the Greek pharma industry was able to export products abroad to other countries in need of these materials and drugs. We saw some really extraordinary business initiatives in order to build productive capabilities for supplies in Greece, like masks. Before the pandemic, the global market on masks relied exclusively on China. So I reckon that, as I said in the beginning, it's high time for changes to occur. We have certain things in the pipeline. More will come because these are the decisions by the government, and this will create will lay the foundations for a brand new healthcare system, which will be able to meet the requirements, the future requirements, and the demand by our citizens for quality healthcare services. And these changes will allow our country to become a hub for healthcare service, for the provision of healthcare services in the wider area. Thank you very, very much. I'd like to thank Mr. Kontozamanis. The word now to Mr. Xanthos.
Good evening. Let me thank the Chamber for this annual opportunity for a public dialogue on health policy. The point is the day after the pandemic, but allow me to say that we are still in the middle of a fourth pandemic wave, and I consider that we should focus at this stage on how we will make the best possible management, how we'll make correction moves that will avert for our country, and especially northern Greece, to witness a tragedy as that of the previous stages. This is the quest, I believe, at this conjuncture. I believe that we need a restart. in the management, the vaccination program that is stagnated, with a far more focused campaign, focusing on special sensitivity patients such as the immune depressed, the senior citizens, very senior citizens, the immigrants, the Roma, and the reason for the failure of the overall policy, I believe, is that we are divergent as a country from the EU average. And there are many other similar countries like us of Southern Europe, where especially in the issues of global vaccination, they have done better than us. We need to restructure the preparation and intervention of the health system, placing the emphasis on pre-hospitalization management with the involvement of the primary service, with allocation of the load of COVID cases in private clinics. So instead of enhancing the NHS, not to have a blackout operational, so as not to have this problem of desertion of the remaining needs of the population. Mr. Agousis pointed that out. I've heard that there's a survey of Elstat for the last year says that 37% of the citizens declare they did not have the necessary medical and medicinal care and protection for serious or chronic ailments due to the COVID. And unfortunately, this rate is even higher at poorer social classes. It reaches 50%. And therefore, it is obvious that we had a drop in the care of poorer social classes, and this we know. Now, as far as the day after is concerned, because I believe that indeed the discussion must focus on how a serious legacy will be left for the public health system in the post-COVID era. I consider, therefore, the pandemic has demonstrated new needs. Some of these needs cannot be managed solely at national level. The problem of access, that is, to necessary vaccines, drugs, and medical devices and equipment is a global scale problem. There's a tremendous imbalance currently. There's a moral failure, as the World Health Organization has stated, and we should review at large, especially with regard to the innovative products. I consider, therefore, that the proposal made by scientists, Nobel Award scientists and academics for the liberation of the patent is of urgent need, so as to proceed quickly to the immunization of the global population and limit the phenomenon of new mutations, which will continuously undermine the immunity wall that we try to build. With regard to our country now, I believe the pandemic has demonstrated new needs that must be dealt with by a new public health system that must be dramatically reformed. By public health system, I do not entail solely the national health system, but as Mr. Tassos said, also mean a dramatic reform of the structures and norms, and this intervention must be supported by resources. We must have a generous investment in the national health system. Infrastructures must be improved, and there are sufficient financing tools and instruments currently so as to modernize the national health system. What is most important? Most important is to revert the scientific brain drain, and especially that of physicians' emigration, through a new nexus of incentives. Unless we do that with a generous intervention, and unless we signal and give the sign of a long-term sustainability of the health system, unless we make national health system attractive to young scientists again, with a new payment and training environment and new working conditions, we will not have a long-lasting, sustainable footprint. In the day after, we will have a more tired system with fleeing trends of the most honorable members of these people. Now, with regard to pre-hospitalization, the screening, if you like, method, this is where global debate now focuses, how, on the basis of the pandemic, we shift the center of gravity of the system and place the emphasis in the first care, first instance care, the home care, the interlinkage of first care with hospital care, urgent needs, and the post-hospital restitution. The long COVID syndrome is a huge challenge that also asks for a dramatic change. There are new fields, for instance, work medicine. Now we realize the need for the existence of monitoring and intervention mechanisms at the level of health and safety in the workplace, environmental medicine, geriatrics. These are new challenges in the foreground. And as I said beforehand, this must be decided upon. This is a national priority. Let us all converge with the EU average with regard to public health, public expenditure. It is only thus we can have sustainability and effectiveness in our system. We're at a stage where the country invests, and they do well. There are various facets, but we invest in new defense systems, aircraft and boats. We should decide that it is an important priority to invest in health defense of the country, so as to have a total protection of public health. This is It is a presupposition of social cohesion and decency for our country and citizens.
I'd like to thank Mr. Xanthos. Let's give the floor now to Mr. Bargiotas. We can hear you. Sorry, I think maybe it has to do with your control room. Anyway, okay. So I think I'll try to be as loud as possible. We're fine now. Great. So, firstly, I'm really glad to hear what I hear. Ipso facto, there is a consensus. I'd like to first make a comment to the sad passing of Fofovgin Mata. I think the entire country is shocked by that. And this is a legacy, if you like, for the healthcare system because of the efforts both herself and her father had done in favor of supporting the healthcare system. And I think there's one thing we agree upon. We need a brand new system, radical reform. However, I'm afraid that this is the end of any spirit of consensus. Although Mr. Kontozamanis almost outlined all open pending issues in the healthcare system, apart from the administrative weakness, which is tragic in the case of the healthcare system. And Mr. Xanthos, on his part, added some additional concerns about the future developments in modern medicine, and actually the Greek healthcare system is unable even to touch upon the developments. I think we spend too much time talking about things. We agree on certain things, but there are very, very few things that actually take effect. Let me give you the example of primary healthcare. The law voted by SYRIZA to a great extent was a copy-paste of the one passed by Mr. Voridis before them, which was written by the PASOK work groups under Mr. Loverdo's spell. So although we agree on the main principles on how to build the new primary healthcare system, nothing has in fact happened apart from the establishment of TOMI, which in the way they operate represent another problem. Regardless of the intentions of the leaders, etc., nothing has happened. And if we want to be absolutely sincere, one of the things that we paid for during the pandemic was full dismantling of primary health care. We have been the ones highlighting early enough that if we have no primary health care, great part of the patients will go straight to the hospitals, so there will be congestion there, and a great part of the patients who need community-based treatment, they won't have access to the healthcare system. I heard that Mr. Kontozamanis saying that there is a need for a demand analysis. If there is something like that available, I'd like to see that. It's something amazingly promising. If there is such a demand analysis in the healthcare map of Greece, so we know what is needed and where. As far as I know, all remedies have been experience-based, and they were dependent on the severity of needs. Currently in Larissa, we're experiencing the fourth wave of the pandemic. Things are tragic. The wave becomes stronger and stronger, and I don't know how we will be able to keep our services available to the non-COVID patients for the next 2-3 weeks. Most likely we won't be able to do that. And although we have successful PPPs here in place, which were helpful, and I will say something about that because I'm not contrary to that by principle, but I have a great deal of concerns about the way they take place. Sadly, we're back again at the dead end because we're now at the fourth wave, according to Mr. Xanthos. I don't know how many waves I've been through, and on the site, on the field, in my hospital, we keep on facing the same problems like during the first wave of the COVID pandemic. So the first thing is consensus is exhausted in our public debates. That's one thing. Second, we all tend, as politicians, to forget that the executive branch of the reforms we're talking about is extremely inadequate and tends to lead to failures of epic proportions. Certain changes have already been underway, and certain changes are stagnated, despite good intentions, because in order to go back to what Mr. Kontozamanis failed to mention and forgets to mention Mr. Xanthos, and we sideline, is the absolutely obsolete and inadequate administrative apparatus of all hospitals. And I'm not talking about hospital managers who are too old, or they used to run garages, or it's not just the manager or the director. We're talking about the entire bureaucracy-sponsored and unable to make real-time interventions administration, even when the intentions are good. Nobody deals with that. Nobody talks about that. Even digitalization takes place in a way that further broadens the confusion. To put it in simple Greek, in simple terms, sending an equipment for repairing takes some weeks in order to be dispatched and some weeks to finance its return to the hospital. This doesn't change unless we have a huge reform in the way hospitals are run and in the way we coordinate the system and the way we build the primary healthcare system using a new, let's say, digital platform. That's my recommendation. we've been talking about that, but we failed to put it in place, to materialize it. We should discuss more about why reforms don't move forward and not about the kind of reforms we need in the system. Having said that, mergers of hospitals, changing the use of certain hospitals, revisiting the demands of certain locations in terms of beds, primary healthcare systems, operation rooms. For instance, in Thessaly is in a tragic condition when it comes to cardiological patients, and we don't do that. And although we have been listening about that, we fail to implement anything. I'd like to have the feedback by both speakers, and I don't doubt their good intentions, and I truly know that they are people who feel the Greek healthcare system, and I'd like to have their feedback on why certain things do not move forward, which at the end of the day represent common grounds. We need to modernize the administration system. Yes, we need primary healthcare in the terms we have already described, and we agree on that. These are two of the multitude of concerns we agree upon. These things started, for instance, the primary healthcare started by Mr. Xanthos, and now we have an utter confusion, because if we want to beat the brain drain, we have to solve the issue of medical education. Currently, it's far worse than 4 years ago, because the reform was half completed, like others, and this created problems. So I believe, in order to be more practical, we have to discuss and consider why the primary healthcare system fails to deliver. One last bit, a comment about PPPs. You mentioned before that in the case of Larissa, for instance, between the third wave and the fourth wave, if it wasn't for the PPPs, if it wasn't for the so-called third areas open for COVID patients and general pathological patients, I'm talking about COVID-free areas, which was the case in Larissa. If it wasn't for that, then Larissa hospitals would have been fully overwhelmed. It happened. Thank God. It was something dictated by necessity, but we keep on talking about partnerships. But in order to have such partnerships, we need a statutory framework. We need public interests to be secured. We need safety, and we have to make sure, we have to have the checks and balances in place in order to make sure that the private sector may hospitalize patients at the certain level provided by international organizations. None of these parameters has been provided in any bill, in any regulation. It doesn't suffice to say that we open the door to the private sector. The private sector is filled with doctors. We know that. Remember what happened in Thessaloniki during the first wave? We tried to broaden the healthcare system in clinics having no qualified personnel. So this kind of statutory framework that would secure that PPPs, which are necessary, of course, in terms of financing and interoperability and in terms of healthcare services provided, because the public cannot provide certain services under certain circumstances. So if we want to talk about PPPs, if we want to talk about transfer of knowledge services to the private sector, we have first to seriously discuss about a statutory framework that will secure public interest, secure transparency, and secure quality of services provided by the private sector. And the public sector, if I may add, in a way that's single, uniform, and efficient. Without that, PPPs may deliver and may not deliver, may be to the benefit of the public and may not be, and it might, and of course, by receding this way, we will be able to transfer certain workload to the private sector, but not in a securely efficient way. Thank you very much. We'd like to thank Mr. Bargiotas. Now the floor to Professor Yannis Tountas.
Good evening. Let me thank, in my turn, the Hellenic American Chamber of Commerce for the invitation. Let me also express my sorrow and condolences for the premature death of Yannis, who was a politician of high morality morality. They had the honor to cooperate in the past for the establishment of a modern new institution in our country. With regard to the subject that I was invited to elaborate in the few minutes that I have at my disposal, and I would please ask my dear Mr. Telloglou to give me a warning sign at the end of the 10 minutes. I will agree with all the remarks of the three previous speakers, because I believe that they all three are persons that know very well the field of health. They have made great efforts all these years so as to improve the field of health, and all the remarks they voiced agree with me. What I would like to stress, however, is that we were invited to speak about the post-COVID era without knowing when this era is due, without knowing what this will be like. And I say so because beyond this doubt we have, or the incapacity to make a crystal clear prognosis, let us not forget that the country has entered a brand new era of emerging pandemics, which means that beyond these 30 pandemics that have been registered the last decades, it's quite probable that we will find ahead of us new epidemics, new infectious diseases, and this might be an everlasting threat for the health of humanity, stemming from the imbalance of the relation of modern man with natural environment, especially with the nutrition chain that has been heavily and violently imbalanced from the increased demand for animal proteins all those years, and on the other hand, the husbandry and the horrible conditions of animals, so as to cover these needs, because most of the epidemics of previous years had to do with animal diseases. Therefore, I would say that what we currently experience, we should view not only as an opportunity so as to draw useful conclusions for the post-COVID era, but also in order to draw useful conclusions at large for an era that might have a lot of negative surprises in store. Now, with regard to what Mr. Bargiotas said, why all this that we agree upon? We must modernize the administration of hospitals, have registries, rationalize the distribution of material human resources. Why hasn't it happened to date? My reply, although this is a multivariant phenomenon, but my view is that mainly because the national health system is a state entity with great problems instead of being a very modern public organization. And as long as it says a state public administration service, which is actually governed by the Bureau of the Minister of Health, will never be able to proceed to such plannings that we will have a depth in time, that we will have scientific documentation, that will have a broader consensus, both scientific and societal, so as to bring about the necessary changes. For this reason, in the study we conducted a couple of years ago, before the onset of COVID, of course, the Analysis study on new SC, we speak of a new SC, of a new national health system, because those changes that have to be effected are not, to our view, changes that can happen overnight or become sustainable as long as they are fragmentary, are not integral part of an integrated plan for a new national health system. Mr. Kontozamanis said that we must have a new onset for the desired national health system. I'm extremely glad for the fact that SYRIZA some months ago spoke and adopted the term that we also used in our study, the need for a new national health system. I believe that Kinal, more or less, will not disagree on such a necessity, although it has not still adopted this term, the need for a new national health system. In any way, what we want to say that the desired national health system cannot have the constituent characteristics that marked the NHS of 1983, not of course with regard to the universality or the equitable and free access of all citizens to that, but with regard to the stamp put on that by the partisan character and the political partisan character and political administration centralized system that still pesters it. So we must speak of new foundations on modern values that would promote universal character and equitable access, but in a way that will be more effective and will not be just paying lip service. Because currently we have the most privatized health system in Europe. Greeks pay dearly, more than any other European, and this is a disgrace for our country. And it really abolishes any notion of national health system. So the first thing we need is review the values of decentralization, of meritocracy, of the value of the participation of patients in the decision-making centers, of the elected members in local administration. This is a new paradigm, a brand new vision that we must all embrace and support. Further on, as I said, the critical point is the issue of management. What is a modern public organization? That means that it must have from the top to the basis, to the last unit, its own administration executives on meritocracy without questioning its public character. But throughout this system it must have its own administration instruments, both local, regional level, and in the primary health service. This is the first thing which is most important. That's why we propose in a first pilot study to have such a central organization that would do the planning, the coordination, and the assessment of the whole health system so as to gradually put this effort to the pipeline until we are led to a modern, self-governed public organization where, of course, the minister will make the political choices, but there will be an organization totally independent executing those decisions and not have an amassment of laws that are never implemented. The second important issue in our proposal are the hospitals. The hospitals, and indeed, as it was said beforehand by Mr. Kontozamanis, we recently made an effort with other eminent colleagues to establish the need of replanning the hospital map. Because at this point, hospital infrastructure and resources are scattered and all over the place on the basis of historic data or political criteria so as to serve petty politics. We see, therefore, an imbalanced distribution of beds, of human resources. We see hospitals in the region that should be the diamonds in its region, and they are practically deserted or understaffed or without equipment and having a coverage less than 50%, where in order for them to be sustainable to be more than 70%. On the other hand, we lack units, especially in the post-hospital sector. And we see also phenomena where we may have 26 neurosurgical clinics where both public and private sector should have 13 such clinics at the most. This is an example amongst others. You only have 1 more minute, Mr. Tountas. So in this 1 minute left, I'll have to stress once again, beyond the issue for the primary health care, with regard to public health, what Mr. Xanthos said. We must put the emphasis both for today and tomorrow. We must acquire a very strong state service of public health with strong respective regional services, which, however, will not do scientific work. The scientific work must be performed by an upgraded AOD. AOD should not be running around in the country offering service. It should be a big and strong scientific organization planning policies, assessing policies, evaluating criteria, and then we should have a very strong central service and regional services implementing that policy. This is how we'll be able to deal with the current pandemic, where unfortunately you have lost the original successes and have problems that we should not have. And most of all, this very low vaccination rate, which is of Balkan level and not European level, and everybody's culprit for that, not solely the government, and of course the opposition party and the irresponsibility of certain co-citizens. Here is the big challenge, and we have to all respond our best. Thank you. Thank you. On the basis to my watch, we only have 2 minutes left. 5 for Q&A session. Okay. I believe that certain issues are already raised from the first round, and you should reply to those. And most importantly, since we all agree, why don't we have these changes?
Would you like to give a first response, first by you, dear former minister? Yes, as I said before, we all agree that the time for change has come, but each and everyone, especially at the level of parties, has different understanding on how to approach this change. There are certain points of convergence. That's why I said that if we follow the path set by documentation, we will be able to come to terms. I mentioned PPPs. More often than not, we used to have disputes with Mr. Xanthos on that in the Parliament. There are also other points in which our opinions diverge, but we can find some common points, some common grounds. So I believe that the pandemic taught us certain things. Everyone got the lessons learned, and this means that we can find a minimum of consensus. Certain changes in the healthcare system have started already. They will move forward at a more rapid pace the quicker we exit the crisis. It goes without saying that during this period, the priority was given to handling the pandemic, managing the pandemic. We are ahead of a new wave, so allow me to disagree with Mr. Xanthos when he said that the NHS has been COVIDized since day one. From the pandemic, from the onset of the pandemic, the NHS was there, was ready, and we saw that certain of the decisions we took was also taken by other countries in order to facilitate other patients, oncological patients, operations, etc. So there was a huge struggle made in order to serve all our citizens, fellow citizens. Of course, we must never forget that there was also fear. Remember the pictures from shift hours in hospitals with the examination rooms being empty because everybody was afraid to go there. As Mr. Xanthos said, we have the fear of long COVID ahead, so this forces us to prepare the post-COVID map for our country. Yes, allow me to make a comment, especially with respect to the political question. Why, which is the following: why, although there is some common ground on the need to support and reorganize the healthcare system, why doesn't this move forward? The reply for me is not what Mr. Bargiotas said about administrative inadequacy and corroborated by Mr. Tountas. For me, the main thing is the innate, the inherent resistance. We have an overtly hospital-centric system under the pressure of many sectoral lobbies, which at every stage intervenes and places hurdles when it comes to reforms. For instance, primary health care, or when talking about cooperative and centralized healthcare system. I think it's more issue of political direction and guidelines. Everybody says that we need a brand new healthcare system. Yes, but we have to agree on the following. What will be the role of the public sector? It's one thing to say that I have to invest more resources using quality assurance systems, meritocracy, transparency, ways to secure quality services to the citizens, and of course respect to the decency, to the dignity of the personnel and the work conditions. And it's another thing to say that because of the pandemic, I have to give more space to the private investments, to the market, to private insurance companies. I think that's a completely different line of thought, and that's my opinion, it makes no use of the international teachings from the pandemic, which was investing on public healthcare systems and their people. I think, for me, that's the top priority. And as far as vaccination is concerned, because that's the talk of the town very intensely in the past period, I think that there is a lack of taking stock of the things that didn't go well. There was an issue with the overall management of the case over the past 18 months. There was also a poor handling of the vaccination campaign. The supposedly best vaccination program in Europe lies far away from the EU average, and as it was discussed, we have more of a Balkan-like trajectory, not a European one. And I think this calls for an overall review. For me, it's an issue of lack of trust on behalf of a great part of the society vis-à-vis the state, the institutions, the government, of course, handling the pandemic, science, everything. So I think we should review that from a different viewpoint, building measures of confidence in the context of trying to have political and social consensus attained, because this is the only way to overcome crisis of public health, and that was proven in the course of human history. I'm supposed now to give the floor to you as well, right, Mr. Bargiotas? Please, Mr. Bargiotas, don't repeat the same things. Add something more if you like, given what the speakers have said that. And in order to be fair, you have 2.5 minutes each. We can hear you. We can hear you. Yes, the mic was off. Apologies. So I was saying that I agree with Mr. Xanthos for the inherent resistance of an entire universe of lobbies. It's good to have some self-criticism, and I'm writing that in capital letters. Those of us who have assumed responsibilities for fostering such policies, those of us who have the tendency and still have the tendency, and I said we have the tendency of setting the partisan interests before the political necessity. I think it's high time that we became brave vis-à-vis the healthcare system. We need some boldness. The main problem of the healthcare system used to be and still is the lack of political courage to overcome political costs and resilience and resistance, even within your own party. And I'm saying that this addressed to everyone. So one day we have to become bolder and move forward with the self-evident. And what is self-evident is way more important than this resistance. Let me remind you that the single healthcare provider, LP, was objected and resisted by the entire opposition when established. So there have been many reforms like that which are still frozen, and we have to find the political courage to support this or any government to start doing things, because they haven't started doing a thing, at least institutionally speaking and in terms of changes. And we have to stop placing the need for political fronts first that sweep everything on their course. Comment on vaccinations. I think this is an irremediable, let's say, injury we have inflicted. We have to review the way the parties have stood against that. Nobody had a clear position. We have to review the slow pace in which vaccination centers were deployed, and we have to review why, because of political cost, we had to put up with extreme radical opinions. I'm talking about politicians and scientific associations, which of course have a large responsibility. For a long time, lots of people with degrees on medicine used to say things that have been unheard of, and associations, professional and scientific ones, have been tolerating them and fostered these agents of destruction, because currently 1 out of 2 suffering from coronavirus is a non-vaccinated one, a vaccinated individual, and this is a defeat for everyone. 3 quick comments. Mr. Tountas, Professor Tountas. Mr. Bargiotas said something about political courage. Let me show you the other side of the coin. In order to perform these changes that, as Mr. Xanthos rightly pinpointed, we have inherent resistance to them, we need something more than political courage. You need someone to assume the political cost of these changes. And this is something very difficult to be carried by a Minister of Health who, after the dictatorship, no minister stays in office more than 20 months. That's why I'm talking about a different way of organizing the administration. Next comment. When talking about the pandemic and the vaccination, I wouldn't say that our system is impeccable. It's perfect. The system is perfect. It's not the system to blame. It's one of the best, if not the best in Europe, the vaccination system, I mean. What is to blame for the low rates of vaccination is, for me, that we have no public health system organized in such a way to support the vaccination campaign, the pro-vaccination campaign, and convince those who are to be convinced. We had no primary health care in order to have the primary health care doctors in the battle and convey the message in favor of vaccination, because you don't win the battle against the pandemic in the hospitals. No, this battle is to be won inside the community. Third, our country was too hasty to emit a signal that we're past the danger, and under the pressure of economy and tourism, we were excessively lax and removed and lifted certain measures which should have stayed more. And last but not least, I think we should have been more decisive in implementing the status of obligatory vaccination for healthcare professionals many years since many months ago, like in Italy, where the unions asked for that, instead of the case of Greece, in which physician associations were against that, mainly run by leftist groups, saying that they were against vaccination. And last but not least, we should have had a more well-organized campaign in favor of vaccination, and I believe that the committee of experts have been degraded. The void left by Professor Chodor has not been filled. There is a lack of communication, indeed, and all these problems pile up, and as a result, we have a very low rate of vaccinations. there is room of improvement. We have the time. We have the tools to make interventions, serious interventions, and remedy things. And I think in the coming months we can reach the milestone of 70% of population being vaccinated. I think we can spend countless hours talking about that, but we're way past our time. Now, I'd like to give the floor to the next panelists.